everyone, and welcome to the Flint Community Webinar, your community resource. I'm Jennifer Edwards-Johnson. I get to be your wonderful moderator. And today I want to start with a couple amazing announcements. So I want to shout out the College of Human Medicine graduates, our new doctors that we put out. Special shout out to our Flintstones, our graduates from the Flint campus. Special love to you. Second shout out, happy Mother's Day for everyone who is celebrating, or for all the special people who play the role of mom in people's lives. So special shout out to those celebrating Mother's Day this weekend. We have an amazing group of people here to talk to you today. And it's a really, really great topic, especially because we're thinking about Mother's Day, because we're talking about summer safety for kids, how we keep kids safe, and we're talking about empowering mental health awareness and thinking about the mission of Mercy Free Dental Clinic and all of their wonderful resources. So we're going to go ahead and get started. We're going to start with Amber Hogan, who is a physician assistant.
Yes. Hello. I'm so excited.
Hello.
Thank you for having me.
Thanks for being here.
Yeah, well, thanks for Heatherlynn's mom, kind of, but I'm just glad she's okay.
So should we now we have to tell the story, right? We have to tell the story that we met our wonderful expert today by virtue of Heatherlynn's mom, who unfortunately had a fall, is okay now thanks to our wonderful Amber Hogan, who took amazing care of Heatherlynn's mom. And
way too much credit. She was okay.
No,
I had to reassure her that she was fine. Her mom was really good, actually.
When you're that excellent, you get asked to do other cool things. And so we had to have you because we thought your expertise was important, that Flint got to hear about it. So thank you for being here.
Oh, thank you for having me. Okay, so I'm going to pull up these slides and let me push play on this. So you see everything? Okay, and can everybody see everything? Okay, perfect. Okay, so basically, I'm just going to talk to you about orthopedic urgent cares and injury prevention, just so you don't have to come in and see people like me, especially during the summertime. That's when we have a lot of injuries, especially for the kiddos, and even the adults, because it's nice outside, and when it's nice, we're out longer and we do things. So I run, and I'm head of orthopedic urgent care here in Grand Blanc. It's basically part of Greater Michigan Orthopedics. It's an orthopedic surgical practice. We are located right Health Park Boulevard, located near the Ascension Hospital. We're right on campus with them. If you're familiar with the Athletic Health Club here, we share the same building, essentially. So you come down here, you'll see me if you hurt yourself. So about Ortho Express, like I said, we're direct relation with GMO. I work with a total of 6 surgeons. There's a hand specialist, upper extremity surgeon, foot and ankle, 2 foot and ankle surgeons, 2 sports medicine surgeons, and then all of the about 3 or 4 of my surgeons are specialized in total joints, so knees, shoulders, hips, things like that. Ortho Express was originally established in 2021. I was hired in the same year, which worked really, really well, because I just got pregnant and had a baby and needed to move back home. I was in Minnesota with my husband, and I was like, I got to find a job. And this looked great, because basically what I do now is what I did at my old job, on and off. And like I said, they really started it because after COVID, they saw a lot of orthopedic injuries weren't treated the best, because there wasn't a lot of access to orthopedics, because it wasn't essential, so to speak. So that's why they started it. We see just about all insurances, so if you are in the Grand Blanc area. So this is what we see. This is our list. Basically, we see acute injuries only. When we say acute, usually within 6 weeks is when I like to see a person. It can go up to about 8 weeks or so, but normally 6 weeks. You see everything from sprains to just insidious joint pain. We also see dislocations. Definitely depends on what type of dislocation. You can't come through with an open, fracture that's dislocated, you gotta go to the ER for that. But ankle dislocation, shoulder dislocations, finger dislocation, I've reduced a lot of different body parts. Fractures, obviously, muscle strains, swelling of the joints also, as well as just tendonitis. So a lot of sports injuries as well. We do not see, because this is important, some people think we're just the run of the mill all day. We do everything shop, chronic pain. We do not see, we're not pain management clinic. I try to tell patients, I tell my MAs, like, if they mention they're here because they have pain or want medicine for pain, I'm like, wrong place. I don't do that. I got to treat you. We do have referrals for you to go to pain management, though. Where I don't do second opinions. I leave that to my surgeons. I really, if you want a second opinion, you need to talk to one of our surgeons if that's the case. Like primary care issues, we don't do. I've had some people come here with a lot of dermatology issues. Like, well, this is on my foot, and I'm like, yeah, just because it's on the body part doesn't mean it's orthopedic related. So you got to go to derm or maybe see your PCP. We also don't treat gout. That's once again primary care, just because there's a lot of maintenance medication that goes along with that sometimes. And then I don't personally see any previously operated body parts. So if you had sutures recently put in, some type of surgery that was just done, you need to follow up with the person who put those things in place and made that happen for you. And we also do not currently see back or spine, just because we don't have a spinal doc on our staff as of yet. Differences between a regular orthopedic urgent care and a regular urgent care. First, our biggest thing is we have fast referral to a surgeon. So if you come in and see me and I believe there's a chance you need to have surgery or needs to be addressed and talk to the surgeon, I can get you in within the next day or two. Versus regular urgent care, they really don't have that. They can just say follow up with the surgeon, try to get you in with a week or whatever, but time is on your side when it comes to seeing me. Also, x-rays here are read on site. We have our own x-ray machine, our own x-ray techs. I read the x-rays myself. If I have any questions, I go to my surgeon and they will also help me. We'll talk about the x-rays as well. Urgent cares, yes, they do have x-rays on site. Does not mean that they have people to actually read the x-ray or who are trained to read the x-ray. Also, sometimes they do not have them on site and they have to send it out to like a radiologist. So it can take a day or two to get your results. I've had patients who come in to see me and it's been like a week and they're like, I just got a call from the radiologist when I went to urgent care. We also do our own casting, splinting on site. You don't have to worry about improper casting or people who aren't trained to cast properly. I do my casting. My MAs are taught as well to do casting. So is just about everyone else who works in the office, who's a provider. We do our own reductions, like I kind of mentioned earlier, that we do see dislocations. So I'm able to, we do give some anesthetics for certain dislocations. I do say though, I'm not an emergency room. I can't sedate you. I can't knock you out where you can't not feel it or you're gonna not be awake for it. That's one thing I do kind of disclaimer to every person that comes in with the dislocation is that we can put it back, but I can't make you so comfortable where you're not gonna fight me on putting it back. So I do give them that option sometimes to go to emergency room. We also have established and continuous care versus urgent cares normally don't. They're more you come in and you get treated for that and you go off to wherever they referred you to. If you come into Ortho Express, you see me normally, if for some reason, unless it's just a one-time thing, I'm like, hey, you're fine, you go off and do whatever you want to do. But if you do need to come back, we do have established care. We make appointments. You come back and see me. I keep track of your progress and things like that. Other thing we offer here are target joint injections and ultrasound. We recently just started an injection clinic for like knees and shoulders. We use ultrasound for that. We also use ultrasound for other things that could maybe diagnose like cyst or like Baker's cyst and things like that as well. So that's just another perk of coming to orthopedic urgent care versus a regular urgent care. Now, injuries, spring and summertime and injuries. You see the pictures, everybody's happy and having fun, and this is great. But this is where every picture I see an impending injury, which is why I put these up here. And it's just the most simplest of things. Kids running, you trip, you fall, sprain ankle, broke a toe. Same thing with this volleyball in the sand, this man leaping, that's the elbow or knee or something that's going to come in. The third picture that just looks bad, I don't know. But these are all the type of injuries and stories that will come in to see me summertime and springtime. Common places for parks, sports, obviously. Bikes are popular, scooters, any of those things, hoverboards, because that's newer nowadays, rollerblades, and trampolines. I have an exclamation mark because those things are very dangerous for kiddos. I am not a fan of trampolines. I used to be until I got into ortho. That is where a lot of my smaller kids will have a lot of their injuries due to double jumps or jump too high or miss the landing. Is trampoline parks. It's just trampoline. Yes, very commonplace. So bike, monkey bars. That's another one. The kids at recess on the monkey bars may have slipped, they fall. A lot of wrist fractures can happen with that. Like I said, trampoline, perfect size for a little person that would come in and see me. Is this little girl for like a tibia fracture or an ankle fracture? And then how do we treat them? So we know a lot. I think maybe some people may have some of this, but rice is like one thing that we've heard like for a very long time. Rest, ice, compression, elevate. I always say go to that first thing. If you twist your ankle, you twist your wrist, something, if they're elevated, ice, try to wrap it and stay off of it if it's possible until you can obviously see the appropriate provider for that. If you are unable to walk, if you can, a lot of people most of the time have crutches. Ask for a pair of crutches. You might have some in your closet. A cane, a walker. People get it like, I don't want to use a walker. I feel old. I'm like, yeah, but you can't walk. You need something to get you to where you have to go. So it's about what is most sensible and what you can get your hands on. Anti-inflammatories or acetaminophen, Tylenol, ibuprofen, Motrin. If you are able to take these, I usually will recommend that you take that. A lot of people come into me and say, oh, well, I haven't taken anything. And I'm just like, well, take something. I don't want you to be in pain all the time, and they'll come to me and say, I didn't take any today. I wanted to be in the maximum amount of pain. I'm like, I don't want you to do that. If it hurts, I'll find a way to make it hurt. But I don't want you to be uncomfortable. So yes, if you have Tylenol or Motrin, ibuprofen, Advil, Aleve, please take some of that. It will help with the swelling, soft tissue swelling, if anything, as well as your pain level. Obviously, if it is bony parts of the body or muscles, see ortho if possible, as soon as possible, or your primary care provider. That way they can refer you to the appropriate doctor to see. Dislocation. Some people it's very easy to get a dislocated finger. Playing football, finger comes out of place. If you are in the middle of nowhere and you can't get to someone, the one thing I say about dislocation, try to make it look as normal as possible, as soon as possible, if you are not able to see a provider ASAP. So if it is a finger that's leaning off to the right, try to bring it back to the middle. Same thing if it's to the left, bring it back to the middle. Ankles, if your foot is next to your ankle bone, try to bring it back down straight, make it look as normal as possible, and try to find a splint. When I say that, something hard, something rigid that you can board it with, whether that just be a stick out in nature, or maybe like a piece of really thick cardboard, something that's going to allow that area to be anatomically straight and keep it in place until you can go to emergency room or see me or a doctor or any other physician. Injury prevention, which is, I do this a lot with a lot of my kiddos now, but and also some of the parents, like especially with little kids, if they're taking them out, like just be aware of uneven ground. Uneven ground is the best place to twist an ankle. So just be on lookout, you know, try not to run through holes and patches and things like that. For rollerblading, skating, bikes, I know they're not cool, but try to enforce knee pads, wrist guards, especially for the younger ones, just to help avoid injuries, especially knee pads. I've had a lot of kids have like knee dislocations after falling off a bike, and things like that. Wrist guards are important too. Once again, you know, you're going to try to stop yourself with your hands out. The wrist guards will help prevent that because they do add that rigidity. Proper shoes for activity always. I tell a lot of the kids, like, I don't need you sprinting in flip flops. They're not good to do that. That's not what they're for. Try to wear a nip shoe or something that gives your ankle some type of support as well as your foot. Supervision, very important. Not saying that any of these parents are bad, but when it comes to trampolines, please watch your kiddo, because a lot of times I've noticed a parent will be like, oh, well, I just, you know, I was inside and she was on a trampoline and things like that. I'm like, yeah. And then I don't know what happened. The next minute they were screaming. I'm like, yeah, just make sure you keep an eye out on them, especially if there's other kids, bigger kids with smaller kids. Please look at it, because it is so easy for one kid to fall on another kid, or the other kids start jumping, like double jumping the other kid. It's just, so just, you know, that little extra bit of supervision for those type of activities. And then be smart. You know you shouldn't be doing it, if you know there's a possibility to hurt yourself, just don't do it. Don't jump off of docks that tell you not to jump off of. Just try to be smart. Sports injury prevention, because sports injuries are really big now. I tell this really to like my teenagers, so like high school, some middle school to high school. Rest your body. A lot of my kids will come in here and be like, well, this has kind of been going on for 2 months or so. And I'm just like, well, it's been on for 2 months. Why did you wait so long to come and see me? So pay attention to it and rest. And a lot of time it's just overuse. A lot of groin strains, hamstring strains. I've even had a femoral neck stress fracture come in for a 16-year-old who just was a runner, constantly running. And yes, you're young, but your body is also still developing. So it is still possible to make things worse. So rest, I always recommend rest. Proper stretching is huge before and after activity. Sometimes even in between, depending on what type of sports you're playing, or if you are recovering from an injury. So proper stretching is very vital. And listen to your body. So runners, baseball players, I put those down just because they're the main ones who will come in with a lot of runners will come with a lot of stress fractures throughout the foot. Like I said, there was a hip stress fracture. Baseball, there's that. I don't know if anybody's ever heard of the Tommy John surgery, but my pictures will come in with elbow pain that has been going on for X amount of weeks to months. And they're like, well, now I can't release properly anymore. And I'm like, well, you got to stop pitching so much. Once again, the rest part comes into play. And then also you got to listen, because if it's 2-3 months, then there's a chance that might have to be fixed surgically. And that definitely does kind of put a halt in your baseball career right now. So baseball players, if it starts to hurt when you're just pay attention to it and say, well, maybe I need to back up off the pitching a little bit. Maybe I need to not pitch as hard for a little bit. So that's why I put that down there. And as I said, don't wait until you can't do something. So don't wait until you physically can't do the activity anymore. That's what happens a lot. They'll be like, I just can't run anymore. I can't, or like it hurts to walk now. It wasn't hurting before, but now it is. I'm just like, you got to come in sooner or get it addressed sooner. Kids love to play their sports. They don't like to sit out, but I tell them if you wait long enough, there's a chance you can be sitting out for a much longer time. So I always just tell the kids that. That's about it. Any questions at all? Or
This was super amazing, especially as we head into the season. You tell us, you mentioned stress fracture a few times, and I've heard of this and I know what it is as a primary care doc, but I wonder if you tell us like why it happens. And you talked a little bit about people who run, but if you just.
yes. So basically, a stress fracture is just an area of the bone that has repeated trauma. Eventually, that repeated trauma will interrupt the cortex of the bone, and you have something called a stress fracture. It's not something that you can't really, doesn't happen. Like, let's say if I just hit my elbow one time, I got a stress fracture. No, this is something that's been basically occurring and occurring and occurring. So with runners, I use them as a prime example because your feet are constantly striking concrete or they're striking something, and that's just increase. It really usually starts out with edema within the bone. That edema will eventually lead into the stress part becoming a fracture. So repeated trauma to those areas, especially like non-padded areas. That's why the foot happens a lot. A lot of people don't have padding on, a lot of padding on their feet. Hands, I've had a catcher come in, just repeated balls to the palm over and over again. Once again, not a lot of padding, not a lot of cushion. She was beginning to get a stress reaction throughout one of her metacarpals. So it's just that repeated trauma that causes the bone to eventually kind of start to break itself because it can't hold itself together anymore.
So it's like, if it's this, and it's funny because anytime I have patients come in and talk about this, they're like, I thought running was good. Like, I thought we were supposed to exercise, and you're telling me that this happened as a result.
Running is great. You just got to rest.
You just got to rest. I love it. So as I think about a stress fracture, I hear you saying, gosh, you have this repeated trauma. It creates some like swelling and inflammation and irritation that can sometimes lead to more stretch of the bone and an eventual fracture of the bone.
Exactly. And usually you'll know because history wise, if a person comes in and says, well, I do run a lot, or I walk a lot, or I'm kind of like, well, how often do you do this? Oh, I run about 5 miles a day. And I'm like, okay. Well, how often do you run 5 miles? Oh, like I've been training for something. I'm like, oh, okay. Now I get what's happening. I'm like, does it ever hurt? And then another thing is too, you'll ask the patient, well, does it hurt while you're doing the activity, or does it hurt all the time? And they'll be like, well, really, it really only hurts right after I did the activity, or I can't do the activity. I'm like, so that's the stress. Once again, that's an example of the stress. That stress is the running. Like I said, that pounding of the foot, where when you're walking, you're not pounding as much. There's not as much striking going on, so you don't have it. But if you let it go far enough, you will have those issues even when just walking or bearing weight on it, which is not good.
All of you. She didn't say don't run. She didn't say don't walk.
No, not run.
Careful and that you should rest. That's what I heard.
Exactly.
Before we let you go, I want to make sure we get the hours of the clinic and when people can come see you or your colleagues.
Oh, yes. So like I said, we are on the Ascension campus. All right. We are like our landmark. I just use Athletic Health Club. But our hours are Monday through Friday. We operate from 11 a.m. to 6 p.m. every day. If I'm not here, then one of the docs, one of the surgeons will be covering, or we even have another PA that helps cover for when I have to be gone as well. So you will be in good hands regardless. You will definitely be seeing someone who is more than qualified. Sometimes you even get lucky and see the surgeon, which is great, because if you need surgery and you see the surgeon, guess what? The surgeon will be like, hey, we can do surgery tomorrow, or we can do surgery, whatever. But even if you see me, you will be able to see the surgeon as soon as possible. I'm pretty like I'm very precautious, and I overdo it sometimes. I'll even tell people like, I don't think you need surgery, but I'm gonna have you see him. I'm gonna have you see him in a couple of days just to make sure. But yeah, those are hours: 11 a.m. 6 p.m. Monday through Friday.
Super appreciate you and all your expertise. Thank you for coming on and telling us all about the things that we should be nervous about.
Thank you so much for
Oh,
having me.
awesome. Thank you. All right. Up next to tell us more about the things we need to be thoughtful about. We've got Nicole and Daniel Campbell here to talk to us a little bit about outreach and injury prevention and safe kids. We're so happy to have you. Always good to have you back, Nicole. Thank you so much for being here. And shout out to Danielle. And before we get into the presentation, I want to drum roll and I want to talk about our good news from Nicole.
Oh, I'm going back to school. Yay. Because education is very important, right?
Awesome.
I'm getting my master's in forensic nursing. I'm in that program now. And then I plan to piggyback into the nurse practitioner program. And I aim for trauma recovery. Danielle has been with Hurley for 19 years. She's awesome. So she's more like the Center for Health Outcomes Manager, adding injury prevention, and leading it over here. And summer safety is huge. This is Danielle. Summer safety. I'm just going to breeze through our May really important programming. We see obviously is the Children's Hospital and our trauma department, level 1 trauma center, the only one here in the region. The Safe Kids programming. This is verification years for our trauma center, so it is a busy time. Next slide, please. It is May Trauma Awareness Month, so this is a national thing. So I love that they used injury prevention as everyone's business this time around this year. So we are looking at those linkages, the community collaborations and partnerships. It's always a big deal, but I think that May, it's a good time to highlight it. Next slide, please. And it is everyone's business, but I always have to say that no matter what, in the state, the region, and here, still falls far surpass our injuries that we see, which I'm sure Amber can speak to that too. But we see a lot of injuries, and the colors are differentiating men and women. Women have more falls, so we're always focused on falls and the prevention of falls. Please, the next slide. The important parts of May, although it's general like national month for injury prevention, we have bike outreach, bike safety week out for outreach on that topic, water safety, child passenger safety, technician week. And of course, we're going to go into Children's Mental Health Week here today too. We're going into that beginning of June, which is firearm safety, which is also a big summer initiative that we work on any kind of prevention in the area. Our admissions for all these go up in the summer. So I am going to paste some things in the chat as well. If you go to the next slide, please. There is a toolkit I'm going to put into the chat. There's one bike safety and most of those topics. They're great for professionals in the health, public health, medical providers, fields, and the like. But then also this one for the water safety toolkit. So drowning is still one of the number 1 causes. I can't paste the link. It's weird. But it is the NDPA, the water safety season, the whole seasonal kits. Here's a big link actually. And it is available. There's so many resources out there. There are the toolkits you can share with patients. There are the fitting for the helmets, all the tips, the tricks, all evidence-based as well. If you could go to the next slide, please. And I will say for mental health, because we have all the safety of the basic injuries. If you go to the next slide, the ACEs conference is coming too. So I know that Tardis is going to go into that a little more, but as an ACEs master trainer, we try to get to the root cause about any of the injuries that we can. So I have to shout out the ACEs conference is May 23rd. So if anyone is interested in going to that, Safekids.org, it is literally the best resource. You can look up by age, by injury, whether it is car seats. There are general toolkits. It has everything that you can share with your families, your kiddos, patients, and the like. If you go to the next slide, I'm breezing through here though, but specifically to Hurley, if you look at Safe Kids or if you look at safekids.org, there's also Safe Kids at hurleymc.com. So if you need something specific, there are a whole bunch of Safe Kids related, if it's specifically car seats, for example. Again, I could tell you each of the action steps, but I'm breezing over it all. So I hope that's okay. You can definitely look further and deeper into the topics. And you can always reach out here to the hospital. If you need a car seat appointment, we are running a wait list, but they increase over the summer because it's easier with the weather. But plug into the network. And I have to go to the next slide. This is going to be a very pertinent, I'm putting in the firearm safety because this is coming up and it takes a lot of our energy and our resources. We want to get the checklist out for safe storage going into the summertime. Again, this link is not working, so I'll let that go. But there are such an increase of these injuries coming into the warm months as well. So knowing that you have these conversations with the kiddos, knowing how to and where to store firearms separate from their ammunition, having these discussions with the family, knowing that people will be safe going into the summer months, situational awareness, very important, and taking those reasonable steps as a family to prevent. We do talk about these checklists in the fall as related to fire and burn safety and whatever the month is, but we know that those physical injuries, bikes, car seats, everything, water and drowning prevention, but that our violence prevention in the summer, we need to really extra focus on these. If you go to the next slide too, you can, at Hurley, you can request a Stop the Bleed class. So going into the summer, have extra tools, get the tourniquets. We have the grant. We can provide classes in the community for our whole region. We've done all the schools here too. So we're making sure that everyone has what they need to try to prevent. But in the event something happens, we want to be able to empower people to manage. And if you just go to hurleymc.com again, and then look at the state too, because that checklist and all of that safe storage and extreme risk protection orders and all that information is available widely. But next slide, and the last slide, if you like injury prevention for like trauma centers and how we do safety in the community, please consider saving the date for our October. It's our state convention for the Michigan Trauma Coalition. It's in Port Huron, October 17th. And it's a broad audience, everyone, medical. We've got everyone in clinician, social services, anyone that wants to do safety. So I just wanted to share all of that and hope everyone has a great summer, an amazing Mother's Day as we all keep our kids safe and look for all the ways that we can prevent injury and keep everyone safe. You feel good? You want to shout out anything,
great.
Danielle?
Thank you. Nice to meet everybody.
Good.
Danielle.
And really appreciate the opportunity to share as always.
Yes, no, we always love having you. Can you go back to your ACEs slide? Tell me a little bit. So there's this big ACEs conference coming up, and
yes,
tell everyone what that means and like what the core functions of that's going to be.
The adverse childhood experiences studies with a really long story short, but amazing. If you look up Nadine Burke-Harris, she has a super video on it. We have for Children's Mental Health Awareness Week, where we prevent upstream root cause. We prevent events that are adverse for children, which lead to toxic stress. There are a cohort of us that were trained to be ACE Master trainers in the area. And we're doing a lot of education and lobbying and everything we can to collaborate around the prevention of toxic stress and adversity for kids. So this is an amazing conference. This is May 23rd, and it's every year. It's usually in Lansing. MPHI is one of our big ACE sponsors. But if you look at miace.org, that's our Michigan ACE initiative for this cohort. So if you go to the miace.org or just look this up, you'll see there's this conference. It's going to be May 23rd. Every collaborator in this group is phenomenal. And just to add to that, we do a lot of the DEC programming, the Drug Endangered Children programming. If you look at DEC through Michigan State Police, again, if we can get ahead of the root causes, we really try to work on that.
What would you say are some of the root causes? So when we talk about ACEs, you and I know ACEs to be adverse childhood events that really have poor outcomes as children grow up, right? And we've seen that data. But could you share a little bit with our group? Like, what does that look like? What are adverse child events? What would be categorized?
Oh, we can run the gamut. We look at the capital T and the lowercase t, the big trauma, like those big physical injuries. And experiences, and then the lowercase t are typically our emotional subset of categories. We can go as broad as everything equity. We can look at social determinants of health. It's really a rabbit hole that, I mean, it's one of my favorite things to research, go down and advocate for. But when we started looking at things like youth suicide and we start looking at youth mental health, but the substance use, those choices that are made, it's not always putting on a bike helmet. It goes deeper. And why are these choices made? And wait, why are we doing Narcan in the schools? You know, we're trying to get up to these making safe choices at its core. Is it family? Is it community? Is it personal? So there are just big teams of people in the state of Michigan working on this a lot.
Yeah. My last question for you is, I made the joke before Nicole came on. I was telling her every time I talk to Nicole, I feel like I want to bubble wrap my kids because I learned so much stuff about like what I need to be doing and what I haven't even considered. And I feel terrible because I'm a primary care doc, so I should know most of this. Right? So as you think about all of the information you provide us as parents or people who have loved little ones that we're thinking about, what advice do you have for us to be thoughtful about incorporating all of this, but like making sure our kids can still have fun and play and not be too overprotective?
I mean, do something. If you see something, do something. If you can take a step, pay attention. Those are the biggest things. We have to care for ourselves, but we have to take care of, each other as a community. And then all of us childhood stakeholders, we need to take care of the kiddos. I mean, we just are going through the filter at Hurley of who's coming in the doors of the emergency room. Oh, these injuries come in more. Oh, we have to increase those prevention programs more. So we look at, and it's relative to where you're at. But no one wants to see these. If we can prevent them, we have to do it.
Yeah.
We can always do more.
If you see something, do something. Have an awareness of your resources. We super appreciate you, Nicole. Thank you so much. And we're looking.
Thank you for advocating for injury prevention always.
Yeah, we appreciate you. Change the mindset of if they're okay playing through the pain. I love that. Thank you, Nurse T, for that comment in the chat, because I think we do often, and Amber kind of mentioned that too, you don't just play through the pain necessarily. We got to figure out what's going on. So thank you for that point. And thank you for that wonderful segue into the work that you're doing and allowing us to bring you on with Dr. G, who we're going to get on Spotlight too, if we can. But I'll let you go ahead, Nurse T.
Hi. Hi. Good afternoon, everybody. Thanks, Nicole, for that awesome presentation and the one lady prior. What me and Dr. G is going to talk about today, I'll go ahead and get started until her camera has access, is Break the Silence. I'm Tarnisa Martin. I'm the patient resource and community advocate for Hurley Medical Center. Or Dr. G, introduce yourself.
Hi. Hello, everyone. I'm Dr. Latressa Gordon, DNP RN with Michigan United, the Director of Nursing Public Navigator Program. Also, I love all the other presentations because I'm a patient with Amber. I've seen her before for my torn meniscus I'm working on. So, but today we'll be talking about Break the Silence.
Okay. Next slide, please. So I would like to start out by just asking some basic questions. Have you ever crawled up in a corner crying your eyes out because you got some bad news and thought nobody cared? Tried to think normal, but couldn't control your emotions. Felt like everybody talking about you and calling you different. Just wanted somebody to say to you, how can I support you through this? Felt like you were about to have a nervous breakdown. Next slide. Topic of discussion. Every year in May, we openly come together to talk about mental health illness. Communities, organizations, hospitals, leaders, we come to talk about this topic that should be talked about every day of our lives. Our goal is to bring awareness and put in the ongoing effort to reduce the stigma around mental illness and mental conditions for better healthcare outcomes. Next slide. Why break the silence? Misconceptions about mental health often cause people to suffer in silence and their conditions go untreated. Today, we are asking for your commitment to support someone you know that may be suffering in silence. That could be patients, friends, family members, cousins, aunts, community members wandering in the community. But today, we're just asking for you to make the commitment to be able to support so that we together can break the silence. Suffering in silence is a lonely, dark, and uncomfortable space that often leads individuals to the thoughts of suicide. Next slide. Awareness breaks the silence. When we become educated on mental health conditions, we have better understanding and less likely to judge and draw our own conclusions about what we think is happening to our loved ones, patients, and residents that we see in the community. No one chooses to battle with mental illness, like no one chooses to be infected by a virus or impacted by chronic health conditions. Next slide. And I'm going to turn it over to Dr. G.
Hello, everyone. Responding appropriately and activates breaking the silence. We can choose how we respond to individuals that's been infected by mental illness. When people say they've recently been diagnosed with stage 3 cancer, they receive well wishes, prayers, support, cakes, etc. But when a person say they've recently been diagnosed with a mental condition, we stray away and don't know what to say or how to respond. I ask you to take a look at me. What do you see? People see me on the webinar as Doc G, but I've been diagnosed with a mental illness as well. I have PTSD disorder, PTSD. Next slide. Transparency, transitions, and thought. Create safe spaces for individuals to share their feelings of sadness, guilt, being overwhelmed by the ability to cope with mental illness. This strengthens the support of the individual to seek help, resources, trusted healthcare providers, and professionals that can lead to recovery, compliance, and a mindset of emotionally feeling empowered to bounce back, heal, and win. Eliminates excuses, giving everyone an opportunity to be familiar with different types of medical conditions. Transparency breaks down the strongholds of silence. It identifies support, services, information to help everyone understand the importance of becoming mentally fit. Mental illness or mental conditions can happen to anyone. I always highlight how Michigan United, who I work for, create a safe space for me to come into the community dealing with my issue, even the webinar, Nurse T and other people around me, creating that safe space for someone to tell you, hey, I have this condition, or if you see me act this way, you know, and they didn't treat me any differently. So I commend them for that. Next slide, please. Types of mental illness. We have the mood disorders, depression, bipolar, trauma-related, PTSD, personality disorders, anxiety disorders, psychotic disorders such as schizophrenia, eating disorders, and substance abuse disorders. These are all medical conditions and should be treated likewise. And these might be some triggering to some people on the webinar today. Next slide, please. Now turn it over to Nurse T.
Unmasking depression. Dr. G mentioned all of the mental health conditions that a lot of our community residents suffer from or may have been diagnosed from. But what we do see in our community, especially after COVID, the water crisis, all of the social determinants of health, and just not always having resources or that safe space that she talked about, we see a lot of depression. So today we want to unmask depression. What is depression? Depression is among the most common of all mental health conditions and impacts many Americans every day. While we all get sad, feel low, or lacking in energy at times, people with depression experience these feelings more intensely and for longer. They find it difficult to carry on with regular daily tasks during periods of depression. Next slide. Statistics of depression. The National Institute of Mental Health estimates that 19.4 million adults, or 7.8% of all adults in the United States, had at least one episode of major depression in 2019. Episodes of major depression were more common among women, people between the ages of 18 and 25, people who describe themselves as being of two or more races or minorities. Next slide. Symptoms of depression involves the way a person feels, thinks, and behaves. People with depression feel sad or teary, overwhelmed, guilty, restless, or angry, lacking in confidence, hopelessness, or disappointed. And I know a lot of times all of us at some point may have experienced depression, but a lot of us was able to bounce back from those periods of depression because we didn't have those chemical imbalances. Just imagine being sad about a traumatic event and you don't have the chemical, inside to be able to bounce back, and you see things different than everybody else. Next slide. Recurring negative thoughts. I'm no good. A lot of times depression causes people to think that they're no good, that everything that bad happens to them is their fault. Life is not worth living. People would be better off without me. And then I know we mentioned ACEs. When you think about ACEs, the adverse childhood experiences, is also at that time, they may not didn't have somebody to love them. They didn't have the opportunity to learn how to critical think. They didn't learn their resilience. They're always living in survival mode. Next slide. Altered behaviors. And if you see any of these behaviors, not taking part in activities and hobbies they used to enjoy, staying in rather than going out socially, being less productive at school or work, drinking more alcohol, losing interest in sex. If you notice any of these behaviors in your loved ones, don't shy away from them. Just ask them, is everything okay? I just noticed that there's been a change in your behavior. Is there anything that I can do to support you through this? A lot of times people just want support. They don't want to be stereotyped or set aside. They just appreciate the support. Next slide. Now I'm gonna turn it back over to Dr. G.
And some of the physical conditions that you may experience is sleep problems, feeling run down or fatigue, muscle pain, change in appetite, headache, upset or churning stomach, kind of somatization symptoms. Next slide, please. Okay, check your symptoms. While everyone with depression can experience any symptom, men and women tend to experience symptoms differently, report differently. Men are more likely to talk about physical symptoms of depression, such as feeling tired, irritable, angry, rather than feeling low. If you or someone that you care about has been experiencing signs and symptoms for more than 2 weeks, it's time to get some help from a health professional, or have any thoughts of harming yourself or others. Next slide. Okay, just like disappointments, mental health happens and can happen to the best of us. It's not something we can hide, overlook, ignore. We shouldn't be ashamed if we seek physician's care or treatment for physical symptoms, so we shouldn't be ashamed when we need to seek help for mental health concerns that need to be stabilized and put on a path of recovery for better health care outcomes. Like I said before, it is an ongoing process. It's best to come if you have a confide in someone. You don't have to suffer in silence. We're here to break the stigma. We're here to break the silence and take it off of mental health today. So I just want you to encourage you. We're going to put some information in chat if you're VA. We also have GSS crisis hotline. But we want you to, it's Mindful May. So take mind of these information that we provided. And next slide, please. Okay, Nurse T.
And we're about to wrap it up. Exposing the shame changes the game. May is Mental Health Awareness Month. As we mentioned, it's an ongoing effort to reduce stigma around mental illness and mental health condition by sharing personal experiences. Don't be afraid to share your personal experience. Exposing the shame changes the game. And often because of misconception about mental health and mental illness, people often suffer in silence and their conditions go untreated. And that's the one thing that we really want to highlight. That's the reason why we ask for your support and the community support to support community residents, people you love, your family members that maybe have mental illness. We want everybody to get to a place of being mentally fit. Dr. G, take us out with the last one.
Okay, talking openly about mental health can reduce the misconceptions. Misconceptions and help reduce the stigma. Encourage those suffering in silence, unmasked, and seek help and find supportive network. Like I said before, if you have these conditions or anything, seek help. That's all that I have.
Dr. G, Nurse T, one question I have is, what do you do for the person who doesn't believe in any of this, right? You rightfully alluded to this idea that there's shame is particularly in our communities, and there are people who just are like, no, I just gotta push through it, right? Kind of like our running injuries, right? I just gotta push through the pain. How do you approach someone? And you gave some ideas, right? Oh, I noticed your behavior's changed. But what if they just don't agree or they don't believe that these are things that they could be possibly going?
Well, that was me, because like I say, for years I've served in the military, and I hid my symptoms for years. And something like, well, maybe you might want to. I'm okay. That's why I came up with the slogan, "Pray but don't delay." Because oftentimes in our community, I'm going to church. I'm gonna pray this thing away. I'm gonna pray this, these intrusive thoughts away. I'm gonna pray this anxiety away. And then oftentimes when you're in those situations in church and it doesn't, well, God's not listening to me, or whatever belief system that you have, then you'll seek that first, and then until you come to a place that for me it was I had a panic attack during the pandemic, and then that time I said, you know what, I need some help. So that person, you can always just kind of just offer that support until they can get to that place where they need support. Of course, if they're in danger of harm themselves, you have to put in the system, but just continually being that support. As we often talk about Nurse T, like when we first met, she saw me. I always, because also hypervigilant, I'll sit in a certain spot and, I'll sit for myself so I can get easy access. So her first thought, tell me what your first thought was, Nurse T, when you started interacting.
So my first thought, I was thinking, boy, this chick is acting funny. But then I had to tune in and be sensitive and try to figure out why and create that safe space. And then I realized that she had some different types of anxiety, and then she openly shared her PTSD. And so now that helped me be more of a support. So like if we were in spaces to where I could be in the end, but she needed to be in the end, I put her in the end. Or if she didn't sit next to people, and then I understood why, and just made her feel comfortable and not feel ashamed because of her experience in that. And then the one thing I wanted to say too is sometimes, people, they acknowledge it when they're ready. And that's one of the times, sometimes you can reframe it. I know a lot of times people don't really like the terms mental illness or mental conditions. So what we'll say are, what are you doing to stay mentally fit? And a lot of times they can appreciate and they like that better. So just having open conversations and listening, always creating that safe space, and then just giving people opportunities to share how they feel. And then you can make references, to maybe offer them suggestions for help, but staying in our scope of practice, of course. And this is just basically for just awareness, but just creating that safe space so that people can come to the idea that, like, you know what, I need some help. And it's not bad for me to get help. Just because I get help, that means that I'm partnering. As I always say, activating your healthcare power, activate your mental health care power as well, because you become a partner in making yourself better. And there's nothing wrong with that. And we just got to break the stigma of that. If you do have a mental health crisis or you do have a mental health illness, that something is wrong with you. Like we mentioned, when people have cancer or they get bad news about medical conditions, we cooking, we having potlucks, we supporting them. So why not support that family member, that son just got diagnosed with schizophrenic? Why not go over there and say, is there anything that we can do to support you? What do you need? And share resources so that they can feel comfortable to love on their loved ones and, have better healthcare outcomes.
I love the mentally fit, right? Because you all have all coalesced on how we can be safe in our fitness, whether it's running or exercising with our kids or taking care of our mental health and taking care of each other. Super appreciate you and all of the resources that you've provided and all of the expertise that you've brought to us. Nurse T, Dr. G, always good to have you. Thank you so much. All right, we're gonna pivot a little bit. We've got to talk a little bit about our free dental clinic. Thank you so much to Denise Polk for talking to us today about this wonderful event that they've got going June 14th and 15th.
Thank you for having us. We'd like you to know that the Michigan Dental Association Foundation is hosting its 5th Michigan Mission of Mercy here in Flint. It's going to be, the dates for treatment is June the 14th and 15th at the Doherty Financial Center on Lapeer Road. It's a free dental clinic open to anyone who comes and participates. Patients usually start lining up the night before to get in line for this event, and we will treat anyone who is in line. Doors usually open at 6 a.m. and close we have the cutoff around 4 o'clock in the afternoon. And you come in and we go through a certain series of events where we will do your examinations. It's on a first come, first served basis. And we're there to alleviate your pain and remove infections and to provide dental education for our patients. So again, when our patients come in, they can expect an oral health evaluation, diagnostic radiographs, limited dental examinations, and address their pain and infections. Some of the examples of the things that we do are dental cleanings, dental fillings, extractions, selective root canals, potential crowns. We don't do crowns on everything, and limited missing teeth. So if someone has missing teeth in the front and say they're going to go on a job interview and they need to be presentable to clinch that job interview, we can help make their smile where they are more comfortable with it. And the things that we kind of do not do is we don't do any major dental work like implants, dentures, braces, or crowns and bridge, but we are looking to get patients specifically out of pain and out of dental infections, because a majority of patients that have dental infections end up in the emergency room. And the emergency room doctors are usually not prepared or equipped to handle dental disparities. So they usually will get a prescription, they'll get palliative treatment, and they're sent back to their referring dentist if they have one. So what we're trying to do is keep people out of the emergency room by addressing any pain they may have and any treatment they may need that's immediate. We also have a full pediatric area where our pediatric dentists will see children of all ages and address their dental disparities. Again, with the Mission of Mercy, this is the 5th one that we're having. We chose Flint. It's been in 4 different areas around the state. We usually have it every 2 years. We're supposed to have it in 2020, but it got, canceled because of COVID. And then it was going to be in 2022, and it got canceled again because COVID was still, ranking high. And so now it's 2024, and we advocated very strongly to have it here in Flint because we have a lot of dental disparities in the Flint area and the surrounding area. So we are hoping that we can help alleviate some of the discomfort that patients have. Again, the dates, there's 2 dates that you can actually sign up for. The Mission of Mercy actually starts on June the 13th. The 13th and the 16th are set up and tear down days. So what we're going to do is we're going to take the Doherty Event Center, and on the setup day, we're going to turn that event center into a 100-chair dental clinic. And so we, unload the semi that comes in, and we set it all up and make sure everything is running. And then on the 14th and 15th are the days that we actually do treatment. During those treatment days, our goal is to see 2,000 people in those 2 days. So we treat approximately 1,000 people a day and take care of all their dental needs. On the setup and tear down days, we do need volunteers on those days. Also, you don't have to be a dental person in order to help us set up and tear down. You also don't have to be a dental personnel to be a patient ambassador. We need volunteers to be patient ambassadors that help to navigate the patients through the clinics. And so there's a job, we always say there's a job for everyone with the Mission of Mercy. We try to accommodate our community partners in every way we can. Tarnisha and Dr. G have been instrumental in getting us volunteers through the community that are helping us. And we, give all our thanks to them because they've been phenomenal in their support. So
Thank you. This is an amazing event. This sounds, 1,000 people a day is just amazing.
yeah.
I want to thank you so much for telling us about this event. And everyone, can you bring your slide back up just so people can see the dates and where it is?
Yeah, it's June the 14th through 15th are our treatment days.
Yep.
June 13th through and 16th are set up and tear down days. All days are going to be at the Doherty Federal Center on Lapeer Road.
Fantastic.
Okay.
Perfect.
And for more information, you can volunteer at the foundation at michigandental.org is where there's a QR code that you can click on to go take you straight to volunteer services. And to become a patient, all you have to do is be in line the day of the events.
All right, you heard her. All you got to do is be in line. So you show up to the Doors event center and you will be able to be a patient. Thank you so much. We really appreciate you talking about this event, Denise.
Thank you. You're welcome.
I'm going to end today by talking a little bit about someone who is very important to the community, and forgive me as I read because I don't want to miss anything. We want to honor our beloved matriarch, elder, sister, mentor, and friend, Dr. E. Hill Deloney, who passed away on May 9th, 2024. She pioneered the field of community-based participatory research. She shaped the foundation of MSU's community-partnered Department of Public Health. Dr. Deloney is the reason people have come to Flint. She was fearless and tireless in advocating for justice, fighting injustice, building up the youth of Flint, and promoting equity through a better understanding of African history. Her legacy can't be overestimated. We love her and echo her saying, "The universe in me calls out to the universe in you." And that is from our chair of the Department of Public Health, who wrote those words, but it felt like a true honoring of our wonderful community partner. Thank you to all of you who came today, and we will leave with a moment of silence for Dr. Deloney.